Cancer treatment can be very stressful for the body, and some cancer treatments actually can promote weight loss because either preparing or going through surgery, recovering perhaps from infections or problems related to surgery, and also the chemotherapy drugs themselves can cause a patient to lose their appetite. And while it's critical to maintain a healthy weight and not get overweight while going through treatment, it's also not a good idea to lose a lot of body weight. Much of it would be coming from muscle, especially if it's fast and related to medical treatments, and also because then nutrient requirements wouldn't be met. In fact, a few decades ago, a lot of people who died of cancer didn't die of the cancer per se, they actually died of malnutrition because they either couldn't eat or the therapies interfered with the body's ability to absorb and digest food, and so they would waste away. There are some cancers that are more likely to be associated with this kind of a wasting. So our number one recommendation for the cancer person going through treatment is to maintain a healthy weight, or if they're overweight, to lose weight at a slower pace so that we know that they're still meeting their nutrient requirements and they're not losing muscle and wasting away. We also would have a lot of recommendations depending on the specific problems. That's why it's recommended that when people go through treatment, if their weight starts changing or their appetite is changing or they look like they're not consuming a nutritionally adequate diet, that they talk to a registered dietitian and get help from some of these specific strategies. For example, nausea that might be related to chemotherapy can be either managed with anti-nausea drugs or with modifying the diet. For example, cold or room temperature food goes down a little better and isn't quite as distasteful when compared to hot food when someone is feeling a little bit nauseated, or having small meals during the day and snacks of little cold foods that are tasty. Getting help from people, for example, going through treatment can be exhausting, so much so that going into the kitchen and trying to prepare a healthy meal is very tiring. And there are many convenient foods that can be stocked up in the refrigerator and that can help someone eat a nutritionally adequate diet, even though they may have cancer-related fatigue or cancer treatment-related fatigue, which is not uncommon. A lot of evidence has been collected over the past 2 decades of the association between how people are eating and whether or not they're overweight and how they respond to treatment or whether or not they actually get a recurrence. And it's interesting for patients and their caregivers that these two dietary patterns that we've been talking about, a dietary pattern of eating more plant-based foods and eating a dietary pattern that promotes healthy weight control, not only reduce risk for the primary cancer diagnosis, but they're also associated with better prognosis. That even though they've been diagnosed with cancer and been treated, people who eat this kind of a pattern and keep their weight under control are much more likely to survive.